Hi, my name's Debs Hollingsworth. I'm a teacher of 20 years experience. I am a SENDCo. I've worked in primary, secondary and special school settings. And recently I've been hosting a series of events in my local area called A SENDCo. The idea is to try and help parents and families and carers of children with special educational needs and disabilities to better understand the context and the support that they can expect and the processes and the systems in schools. So I thought I'd narrate my videos and share them online to see if I can help more people. You can see on the screen now the structure of the most recent event, which was focused on education, health and care plans. So we started with the tea and coffee. Then I gave a presentation which lasts about half an hour, which is what I'm sharing with you now. And then we had lots of wide-ranging discussions that was really, really helpful. I hope. Feedback was excellent. This presentation is in 3 parts, and part 1 is, does my child need an education, health and care plan? I'm going to start going back to basics. What is an education, health and care plan? An education, health and care plan, or EHCP, is a legal document. It covers birth to 25 years if a young person stays in education for that time. And it sets out, among other things, a child or young person's special educational needs, the support that they require and are entitled to legally, and the outcomes that are sought for them to achieve. We don't apply for an EHCP. What we do is we request that a local authority conducts a comprehensive review of a child's SEND to assess their needs and their required support, an education, health and care needs assessment. Who can apply? Well, the answer is really nearly everyone. A parent, carer, foster parent or a family friend can help with the application. A child or young person's school or nursery can apply. Any health professional who is involved with the child or any social care professional. And in fact, a young person themselves can apply if they are aged over 16 and still in education. In practice, I believe this is relatively rare. An education, health and care plan is underpinned in law and in statutory guidance. So you can see it's underpinned by various things which include but are not limited to the Equalities Act, the Children's and Families Act, the SEND regulations and the SEND Code of Practice, which is a guidance document for SENDCos, our Bible, if you will. The nationally published figures for SEND taken from January 2023 census and published in June of 2023 illustrate the fact that EHCPs are only granted to children who have the highest level of need in the country. Currently 4.3% of children in England's schools, and that's all schools, including hospital schools and special schools and PRUs and primaries and academies and independent schools, 4.3% of children have an EHCP. So they're really not required for the vast majority of children. There are a further 13% of children in England's schools who are on the SEND register but without an EHCP. So in order to answer the question, does my child need an EHCP, we sort of have to go back to the level before that. When a child is placed on the SEND register of any school or nursery, they are entitled to provision in order to meet their needs in order that they may make progress. This is set out in the SEND Code of Practice, and it states that schools, all settings should adopt what is called the graduated response, and that is the cycle of assess, plan, do, review. So regardless of whether your child has an EHCP, they should be receiving interventions and support that allows them to make progress. The assess means that we start by asking what is the starting point, and that can involve observations and parent input and past performance and attainment data, and professional reports if they exist, along with their recommendations and their assessments. Then we make a plan and we say, well, okay, that's the starting point, that's the assessment. What are we going to do to support the progress of this child? For children in nursery up to the age of 5, or early years up to the age of 5, they should be involved in the planning. Beyond the age of 5, SENDCo should notify parents of what the plan is. So you might, for example, get a consent letter to say that we're doing such and such an intervention. Then we do it. That's the do process. We put in place the support that we have said, and finally we review it. We think about the quality and the impact of the interventions that we have been offering, and whether they are therefore being supportive and helpful and the child is making good progress, or whether we need to go back and reassess and replan and redo, and therefore continue that cyclical process. So all children on the SEND register should be having that graduated response, assess, plan, do, review, reviewed regularly, most often on termly cycles, but sometimes more frequently. And they should be getting intervention and support. Generally, we talk about the support the children get in terms of waves of intervention or levels of intervention. And there are 3 waves: universal, targeted, and personalised. Wave 1 is universal, high quality, adaptive, inclusive first teaching. It's the effective inclusion of all children in high quality teaching and learning. It means that the teacher has a good idea and good knowledge of every child in their class, including those on the SEND register, and where children do have identified special educational needs and disabilities, the teacher is aware of the strategies and support that they require to make good progress. Wave 2 is targeted or small group interventions. These can be delivered in curriculum time, or they can be delivered as extracurricular activities, and it's intended for children who can keep up or catch up with their peers, and not only those with SEND. And there's an almost bewildering array of possible interventions. So we've got handwriting practice and times tables practice and pre-teaching vocabulary and social skills groups and Lego therapy groups and transition preparation groups. And it might take place within the classroom in terms of during curriculum time. They might have specific support from a teaching assistant or from the teacher, but targeted to a group. Or it might take place outside of the classroom where children are removed for short periods to focus on specific areas of learning related to their needs. The SEND Code of Practice is very clear that the majority of children will have their needs met within mainstream settings using this graduated response using appropriate interventions. The Wave 3 interventions are much more personalised. They're individual, tailored, specific support, and they often require one-to-one input, and they often require external professionals. So as a SENDCo, we may make referrals to a whole host of external professionals. They include speech and language therapists, educational psychologists, occupational therapists. We might follow physiotherapy programs. We might be offering counselling. We might have mobility teams visiting or working with our children. Not transport, that's different, and transport is outside of the control of schools and the remit of schools. We may well have visiting specialist teachers, mostly coming from local authority, and there's a whole range of specialist teachers for example, children with visual impairment, hearing impairment, profound and complex needs, physical disabilities, and autism. I might have missed a few, and I apologise if I have. We might make referrals to diagnostic pathways, including CAMS or whatever the pathway is in your local authority, and they may well do follow-up intervention work with specific children or families. We might make referrals to social care. There may well be the involvement of medical consultancy teams. Children might require bespoke technology, and usually this wave 3 intervention will require a high degree of teaching assistant support both inside or outside of the classroom. On the whole, when we go back to that question of does my child need an EHCP, on the whole, we would expect, if we are going to be requesting a needs assessment from the local authority, we would be expecting to see some of these, not all, but some of these wave 3 tailored, individual, personalised interventions in place, and within that, as I said, graduated response, so implementing the recommendations of specialists, but then offering if we feel that a greater level of support is required, then that's when we might find that we're trying to collate evidence in order to say to the local authority, look, this child really needs to have a full and comprehensive needs assessment, which may lead to an EHCP being issued because they are requiring such a high level of support in order to make progress. I'm going to talk a little bit about funding, and in particular the notional £6,000 budget, or otherwise known as the mythical £6,000 budget. There's a lot of misunderstandings around this, and even within SENDCo spheres I would say it's still a slightly contentious issue, and there's sometimes disagreements. I've put on the screen here on my presentation 3 quotes that are taken from a recently updated document from the Education and Skills Funding Agency with regards to that £6,000 budget. I'm not going to read it out. What I will say is that, as I see it, firstly, funding is very, very complex, and I've been a SENDCo for years, and I take pride in being relatively knowledgeable, and I still feel like my understanding sometimes I think I'm there, I think I get it, but it's taken me a while. We do not receive £6,000 per child with SEND on our registers. We do not need to spend £6,000 per child on our SEND registers, and nor could we afford to do so. It would quite simply bankrupt the schools. We can choose to spend our £6,000, our notional budget, as we see fit in order to support children in our schools, and there's many ways that we might do that. For example, some of those interventions that we've already talked about, the employment of teaching assistants. We might subsidise school trips or uniforms, or host visitors, external visitors, to come in and work with all of our children or targeted children. Many different ways that schools can spend that notional money. Nonetheless, I think it is a useful benchmark to be saying that if you are applying to or requesting that the local authority conduct a needs assessment, then you probably need to have evidence of some expenditure specific to a child, and that goes back to those personalised and tailored interventions, such as bringing in specialists, offering a lot of targeted support, etc. And this £6,000 benchmark, given what the Education and Skills Funding Agency has published, and given the way that funding for local authorities is now, it is a relatively useful benchmark as to, has the child got that level of need that we can't meet their needs within our existing school budgets, even when we've allocated some of this notional budget specifically to that child. So if we consider, does my child need an EHCP? Then we need to think about the legal benchmark for EHCNA requests. Again, this is often disputed, even among experts and including leading national figures. The Children and Families Act states that the local authority must secure an EHC needs assessment if the child or young person may have SEND and it may be necessary for provision to be made in accordance with an EHC plan. Some interpretations argue, therefore, that the legal benchmark is relatively low because we can look at that may have and may be. However, other interpretations focus more on that phrase and the logic behind in accordance with an EHC plan. So when we make a request to the local authority, we do have to evidence a high level of need in order to secure a needs assessment. So going back to that central question, does my child need an EHCP? There are some notable quotes and considerations. The EHC needs assessment should not be the first step in the process. Rather, it should follow when the graduated response has already been put in place and there is evidence that interventions have taken place. We've got high quality inclusive first teaching, we've got targeted support, and we've started to tailor and personalise a child's support to them. And they still require ongoing additional support, and that means that the attainment gap might be widening or their progress might not be where we want it to be. The local authority has to consider whether the support has already been put in place and tried, and whether they therefore need to look again at this child as to whether they need an increase of input. So I would recommend that you ask yourself some key questions. Is your child receiving support? Is the assess, plan, do, review cycle in place? Is your child making progress? Will your child continue to make progress if the current support continues as it is? And are the required resources for your child to continue making progress available ordinarily within their school and setting? And it's only if you get to the responses that are, well, no, actually my child isn't making progress, or that graduated response isn't in place, or the attainment gap is widening, or you have ongoing concerns around their progress academically or socially, and the school is struggling with all good efforts to ensure that your child keeps up. And it's only at that point that you might start to think, I think my child really needs to have a formal and comprehensive review of their needs. So we're now going to move on to part 2, and that is the application process and timeline. When we think about submitting a request to the local authority for an education, health and care needs assessment, there is a slight disconnect between the law and reality. The law says that there's no need for extensive forms and templates, etc., in order to request an EHCNA, and there is an excellent standard letter available online from IPSIA, the Independent Provider of Special Educational Advice, for parents and carers who wish to apply. The reality is that the local authority always has their own template, and in my experience, schools, when we're making the request, do mostly have to submit that paperwork on their format. Now, some SENDCos would definitely disagree with me on that, and some SENDCos would urge that we don't jump through all the hoops and that we just try to minimise the amount of work and effort that goes into it, because as a SENDCo I would say that I do put quite a lot of work and effort into making an EHCNA request, and I do provide a lot of evidence on the template that is required for me. Hopefully on the whole my decisions are fairly robust and and my requests for a needs assessment are usually successful. Yeah. Ideally, I would say that parents and carers and the SENDCo should work together. The school SENDCo will be contacted by the local authority in order to move forward with a needs assessment, and should the parent make an application submit a request, then the school will provide the same evidence regardless of whether it's a parent request or our own request. The difference, I suppose, is going to be how robust our evidence is. So, for example, if a parent was to say to me that they wanted to apply for an EHCNA, I would look at the evidence available to me. What have I put in place? What have I done? What can I evidence as the input that we've had and the impact that it's had? And do I have ongoing concerns around progress? And you know, have I got all of that graduated response, etc., in place? So the most success, however, I might, however, say that I'm not ready to apply for an EHCNA request at that point, and let's give it another cycle, or let's try another intervention before we move forward with that. Key questions for parents is your child making progress? Do they have SEND? Is that documented? Are they making progress with the current support, and how do you know? However, I know that often, and this came up on the evening when we talked about it with the visitors that I had, that sometimes there are breakdowns in relationships between schools and parents feel that an EHCNA request is required, but the school has limited evidence. It's true that a parent submitting their own request may be able to speed up the process, especially if you have evidence of the needs of your child. And if you submit evidence using the template from IPSIA, for example, to the local authority, and the local authority say yes, there is a need to assess this, you know, to collate all the evidence and have a good look at this child, then you can potentially speed up the process, because then if the SENDCo gets asked for information, we have to abide by a 6-week timeline set by the local authority. And whereas if I'm planning to put in an application or a request, then I might wait a bit longer, so you can speed up the process. But in my experience, the most successful outcomes are achieved where the school and the SENDCo are agreeing where you are on that graduated response, agreeing on the interventions in place, what's going to be tried and what the next steps are. In terms of the process and the timeline is the first thing that you do is you submit your request. And if you're doing this yourself as a parent, then I would recommend you get proof of posting if you're using good old snail mail, and otherwise or use registered delivery. Otherwise, if you put it in an email, make sure you set request evidence of it, or confirmation of receipt. Could you please confirm receipt of this email? When I submit request to the local authority myself, I will always put the child's name, date of birth, date of submission, then the 6-week deadline and the 20-week deadline, so that I can try and keep track of where we are in the process. At 6 weeks, parents should be notified of whether the local authority is intending to conduct a education, health and care needs assessment. At that point, they start to collate a lot of evidence from educational psychologists and medical professionals and all those people we said may well be involved with the child. In theory, at 14 weeks, if an EHCP is going to be agreed and issued, in theory at 14 weeks you should get the draft. In practice, I have got an awful lot of experience of this not being adhered to. At 16 weeks, the local authority should notify the applicant as to whether it is definitely going to issue an EHCP, and at 20 weeks the final plan should be issued. So before that 20 weeks, parents should have 2 weeks to respond to the draft. Every local authority needs assessment must include psychological assessment, and this is most often educational psychology. However, if the needs are more medical based, then it may well be clinical psychology. Applicants can request that advice is taken from specific professionals such as speech and language therapists or occupational therapists. And where reports are already in existence, such as if the school or the parents have already paid for a private EP or OT, then or speech and language, then you can submit those reports, and the local authority must take them into consideration as part of their evidence bundle. The reality in terms of those timelines is that many local authorities are struggling to keep pace with the number of the requests they're receiving, and those 20-week timelines are slipping. I know that in my local authority currently, I think they're at approximately 75% are hitting target, but that does vary from one place to another. And that 14-week deadline, as I say, in my personal experience is possibly a little bit of a fallacy. So what are some of the pitfalls, problems, and what happens in the event of a refusal to assess? It's really important that we recognise that the process of obtaining or having agreed an education, health and care plan is outside of the remit of the school or the control of the school, and it relies on panel decisions. Panel decisions are made at local authority level, and that includes whether to assess and whether to issue plans. It's not the schools. Panels are generally comprised of a whole range of different specialists, and they include, but are not limited to, NHS designated clinical officers or leads, principal educational psychologists, speech and language therapists, school SENDCos can sit on panels, specialist teachers, SENDiAS representatives, and the local authority SEND team leader, which has different job titles depending on where you're based. In some cases, you may wish to appeal or request mediation following decisions that go against you. Schools cannot appeal against decisions. It's parents and carers who have to do that. Although schools, if they agree with you, might support. And you have 2 months to appeal decisions. Those decisions that you might want to appeal include a refusal to carry out a needs assessment, a decision not to draw up an EHCP or issue an EHCP. You might, when you're issued with the final or an amended EHCP, you might not agree with the contents. And also at certain points, local authorities might say that they're going to cease to maintain an EHCP, and parents can appeal that too. The local authority must then, in their letter, notify parents of their right to mediation, and you do not have to go into mediation with the local authority, but you do have to say that you've considered it. The local authority would tell you about this in any correspondence that you receive. If you choose to go to mediation, the local authority must participate. The only exception to the mediation process is that if the disagreement comes when it is only regarding the name of the placement, the name of the school, then it can go straight to tribunal rather than sitting in mediation. If you do disagree with refusal to issue or with contents or refusal to assess, then you may wish to consider going to SEND Tribunal. The first tier SEND Tribunal is an independent national specialist court. It hears parents and young people's appeals against local authority decisions regarding children with SEND and their support, as well as dealing with issues around disability discrimination. If you are considering going to SEND tribunal, you do not need to have legal representation. However, I would say that you probably need to be prepared to do a lot of research, evidence gathering, letter writing and work. If you find yourself in this situation, I would strongly urge you to seek some support. Look at the IPSIA website. I cannot recommend highly enough the IPSIA website, and I repeat, that's Independent Provider of Special Educational Advice. And also, every local authority must have an independent advisory service, support service, SENDias. And so contact the local SENDias in your area. It's my experience that they've been very helpful, SENDias. I know anecdotally of people who say that SENDias is not always very helpful. It depends, I think, a lot on the local area, but certainly I recommend SENDias. So I don't think you should go completely without support and assistance and advice into a tribunal process. It's really important as well to have a look at some shocking national statistics on that SEND tribunal. There is a huge increase in the number of appeals, and from those appeals, the vast majority, when they are finally heard, are finding in favour of families and against local authority decisions. So there is a high success rate in going to appeal. However, definitely quite a stressful process, time-consuming process, and there is the waiting time has reached record levels now. So you may well find that you're into quite a long process. So again, think again about that mediation. But let's hope that actually, if you make well-informed decisions around whether your child needs an EHCP and how you're going to go about achieving that, if they do, that the local authority in your area can be convinced of the need. So what are some of the pitfalls and the problems associated with the process of requesting and obtaining an EHCP to support your child? First of all, I think the biggest issue arising is around poor homeschool relationships. So there may well be a lack of evidence to support the fact that that graduated response is in process and in being followed. And therefore, I know that some parents do feel unsupported by the schools, and therefore there's partnership working possibilities can become fraught or break down. There is sometimes in some instances a lack of support, lack of capacity for support and for interventions in mainstream schools. We know that there is a recruitment crisis in schools for both teachers and teaching assistants. We know that there is staff retention problems in mainstream schools and in schools, and also funding around SEND both at local authority level and within schools is being cut owing to budget cuts, etc. So sometimes, even though the child may require that graduated response, it isn't always in place, and the interventions aren't necessarily in place, and therefore there is a lack of evidence to provide to the local authority. There may well be actual open differences of opinion between school and parents as well. I have, in my experience, had instances in which a parent has felt a child needs an assessment of their need in order to secure an EHCP, and with the best will in the world, I haven't necessarily agreed because I have felt that the child is making progress with the support already available. These things are going to arise, and therefore it's about decision making around, well, do we try to continue with the support, or do we go it alone and make our own request to the local authority? Transitions. Education, health and care plans are supposed to ensure that a child can then, once it's in place, progress to the school of their choosing, if at transition points, or indeed if they feel that the parents feel that current setting cannot meet need. However, there is a bit of a pitfall with this, in that schools sometimes become what we call a honeypot school or a magnet school. That means they actually get a reputation for being very good at supporting children with special educational needs, and it happens within a local area, and lots of parents say, oh gosh, they're doing really well for their children, I want to apply there. And then when a child with an education, health and care plan wants to change school, it is not, you do not go through ordinary transitional routes. What happens is the local authority consults on behalf of the family to any school that that family names, and the schools have a right to respond. There are only a few reasons that a school can state that they cannot meet need, and that is that it would be incompatible with the efficient use of resources, or the incompatible with the efficient education of others, or there's something else, I'm sorry, I forget. But it is reasonable, if a school is receiving a lot of consultations for children with education, health and care plans, then it is reasonable for them to argue that they cannot meet the needs of all within the efficient use of resources and the efficient education of all their children. So in fact, even though parents should have a much greater degree of choice of school, I think in the current climate we cannot assume that an education, health and care plan will definitely lead to you getting your first choice of school. With regards to transitions as well, I do have a number of parents, and it's in my mind, I'm currently working in primary, and that primary secondary transition point is really crucial. Primary schools can, on the whole, ordinarily offer a higher degree of nurture to children than when you get to secondary schools, because their setup is so different. And for example, on ordinarily within a primary school, a child will have substantially one teacher, whereas a child in secondary school is likely to have, in their year 7, often has up to 15 teachers. I did an analysis recently of a year 7 child's timetable, and they had 15 different teachers in a week. So the degree of support offered with one teacher and 15 different teachers is evidently quite different. But therefore there are a lot of parents who suggest they would like to secure an education, health and care plan in order to ensure that their child continues to receive the support at year 7 and beyond, or younger if you have a junior school system in your area. But we can't apply for future need. We have to look at what's happening now, that child's progress now, that child's support now, and whether they're currently making progress, etc. So we can't extrapolate that and apply, for example, in year 4 or 5, because a child might need an EHCP in year 7, and sometimes that does arise. The current pitfall is that there is a national shortage of educational psychologists, and this is having a very great impact on those timescales that we looked at, because, as I mentioned, every EHCNA must necessarily involve an EP assessment or clinical psychologist assessment, but psychology assessment. And with the national shortage of EPs, local authorities are struggling to ensure that their statutory assessments or needs assessments are taking place within that time frame. A problem is that the appeals process is stressful and time consuming, and the SEND tribunal caseload has reached record high, and yet it's finding in favour of families on so many occasions that it's clear that when the law is applied, the outcomes, and law is applied consistently and overseen with legal bods, then the outcomes often result in an EHCP being issued or local authority decisions taken at panel level being overturned. Another problem currently is that there is a lack of special school capacity, and in some places this is really chronic, and so therefore in some areas it is just not realistic to think that within that 20 weeks an education, health and care plan can be drafted and finalised and name a specialist provision. And Therefore, quite a number of children, I think we would say, quite a number of children who perhaps would benefit from and parents would prefer special school education are actually being educated in mainstream settings where the delivery of the interventions in section F, which should be legally binding, are legally binding, but quite simply it may well have interventions named and stated that are simply not available with the best will in the world in a mainstream setting. And we SENDCos will do our very best to implement as much as we possibly can, but I mean, there are even instances that I'm aware of where it has said small group teaching at all times, for example, which simply doesn't exist in a mainstream school, can't. And it's also really important to recognise and remember that a needs assessment does not always result in the issuing of an education, health and care plan. But in some cases, actually going through the process can be helpful for parents anyway, because if the local authority agrees to assess, conducts their assessment and then says no, that when they're not going to issue, they might nonetheless make recommendations that the school then have to follow a little bit greater in terms of the recommendations from educational psychologists, etc. And it can be quite impactful in ensuring that the support is available for children. And finally, I'm going to talk a little bit about the EHCP myths. So, diagnosis. The issuing of an education, health and care plan is not dependent on diagnosis, it is dependent on need. Your child does not have to have a diagnosis in order to get an EHCP. I think that's really important, especially in current climates when we are regularly experiencing 12, 18 month, 2-year waits for the diagnosis of autism, but you don't have to wait until you've got that formal diagnosis and before making a request to the local authority. Progress. The child does not need to be academically behind in order to require an education, health and care plan. It's a myth to say that EHCPs are for children who are academically 2 years behind, etc. What needs to be in place is a lot of support in order for that child to make progress. In fact, I am fully aware of children who are truly high achievers and going to go on to, achieve great GCSEs and go to university, etc., who have required an EHCP in order to secure their provision. It's also a myth to say that EHCPs are updated annually. We have to hold an annual review every year. That's the big meeting where the whole EHCP document is reviewed. But if there are no significant changes required, then the EHCP might not be updated. Now, from a SENDCo point of view, this is really quite problematic, because if year on year there are no significant changes, we find that we've suddenly got a child who's approaching transition, for example, whose EHCP hasn't been updated for 4 years. That shouldn't really be the case, but if we find that we're requesting minor changes year on year, sometimes sadly it is. And I think I've already touched on this. An EHCP is not going to guarantee a chosen school place. Local authorities are increasingly unable to provide special school places even when parents wish for them. Sometimes parents do want a special school place when in fact the professionals around them wouldn't agree that the child needs a special school place. And also schools do have the right to respond to consultations to say that there we go, I've put on there, the setting is unsuitable for the age, ability, attitude of the child. The attendance of the child or young person would be incompatible with the provision of efficient education for others, or that the attendance of the child or the young person would be incompatible with the efficient use of resources. So even though the ideal is that every child with an EHCP then gets supported transitions to the place of their choosing, the reality is not entirely that. Okay, and now we've reached the end of my presentation. If you have watched this far, I would say thank you very much. I hope you found something in it that has been useful or helpful. You can see my email address on the screen if you want to give me some feedback or ask me a question. Ask a SENDCo. I'm just going to mention at this point, because obviously I said at the beginning, this presentation was created for a local event that I hosted for parents, families and carers. And we then led into quite a long discussion around and they're very astute questions and lots of conversation. The most frequent issue arising was the lack of support from in schools, and I think fair to say particularly at secondary level, although I've been a secondary SENDCo myself, so this is absolutely no disrespect intended at all to any of my colleagues. We're all generally quite knowledgeable, capable and committed individuals, but I think parents often feel that graduated response, going back to what we talked about right at the beginning, that assess, plan, do, review structure that every child on the SEND register is entitled to, a general feeling that actually wasn't in place. And I think I'm not necessarily making any suggestions on how to resolve it, except I would say if you feel that you're not receiving that information around the support available for your child, then please do go to the school SENDCo and request and require that information. Another massive issue that arose was where, particularly at secondary level, there was no what we call pupil passport, pupil profile, or individual education plan or individual action plan, a document that is circulated to all teachers that says what the child's needs are and what the support is, etc. And without that, I did have to question if there is no efficient information sharing on the children on the SEND register, particularly at secondary level with all those teachers, then how is it possible for the graduated response to be in place? Because the very first wave of intervention is high quality inclusive first teaching. That means when the child enters the classroom, the teacher knows about it. So if the SENDCo hasn't prepared an overview of the child, then how are the teachers meeting the needs of the child? But again, I'm not going to go into solutions for that. I'm just aware of the problems, aware of the fact that you might be experiencing that. I'll consider doing some kind of presentation or hosting a session on that in the future. But I would say try to work with your SENDCo, speak to your SENDCo, get in contact with your SENDCo, and you can also have a look at my other presentation if you've got this far, which is about the local and national context for SEND, and that might have a couple of other suggestions. Finally, I would just say good luck in your journey wherever you are, and thank you very much for watching this presentation to the end. I'm Debs Hollingsworth, and this was Ask a SENDCo. Thanks, bye.